Thank you. I appreciate the opportunity to present. Hopefully you're all feeling relaxed. And if you're not, then Dr. Sumich's talk on medical marijuana will get you there. So legitimate or snake oil? As part of my project, I did a survey of North Carolina physicians. And just to give you a little background, when I finished residency in family medicine in 2004, I joined a practice that was a part of Carolina's healthcare system in Charlotte that was an integrative medicine practice. And just to give you perspective on the times that have changed since then, back then, no one had heard of a probiotic. We would talk to patients about probiotics, and just by a show of hands, how many of you take a probiotic? All right, and how many of you have heard of probiotics? Okay, so back then, it was pretty uncommon, and now there's commercials on TV, Activia, and all these different things, and so it's become much more commonplace, just as an indicator for you as how the times have changed in the last 14 years. Wow, time flies when I think about it. So, and in the last 4 years, I've started my own practice, an integrative medicine practice, and as a peddler of snake oil, I thought I would want to get a sense from my fellow physicians in North Carolina what their opinions are of some of the products and services that fall under integrative medicine. Now, the NIH calls it complementary and alternative medicine, and we could talk for a long time about the differences between that. I think integrative medicine is a term that has been used or can be used in a lot of different ways. There are practitioners that are mostly practicing in a traditional manner and can bring in other traditional practitioners such as nutritionists and physical trainers and occupational therapists, physical therapists, different people that they can integrate into their practice, and they can call that an integrative medicine practice. Another thing that has happened more as of late with the increase in physician burnout is a lot of physicians are leaving their current practice and set up a practice where they can carve out more time for their patients and call it an integrative medicine practice. Maybe bring in a few of the services that I mentioned. In my definition of integrative medicine, it's more about integrating non-traditional medical practices with currently accepted or norms in traditional medicine. So complementary alternative medicine practices have been present for thousands of years. There's patients with, there's home remedies, there's Chinese medicine, there's so many different things that people will often turn to try to improve their health. In the United States, it's widely available, all kinds of different things, and there's a lot that falls under the umbrella of complementary alternative medicine, and we're going to focus on just some of the few things that have been studied. But it's a multi-billion-dollar segment of healthcare, and it is growing. Just the probiotic market alone is pretty significant, as you can imagine. So just for our purposes, we're going to define complementary alternative medicine as dietary supplements and herbs, some traditional Chinese medicine herbs, acupuncture, cupping, some mind-body medicine, manual therapies such as chiropractic, osteopathy, therapeutic massage, essential oils, and healing touch, or what some call energy work. And I listed a few more things just to give a sense that there's really a lot of other things that can fall under it. There's practitioners out there doing functional medicine, there's chelation therapy. There's so many different things that sort of are outside the norm of traditional accepted medical practices. So what do we know? Well, we know that there's a lot that we don't know. There's really not a lot of data out there, and really because there's not a lot of money in it, right? Pharmaceutical companies are not going to support this, and so there really isn't a collective of acupuncturists in the country that are going to fund studies. Most of it's done through universities, and so there's really not a lot of evidence on a lot of the practices. The other problem with it is that a lot of these complementary and alternative practices do not lend themselves very well to our scientific rigors of double-blind, placebo-controlled studies. And so that also is a barrier. However, regardless of that, millions of Americans are using it. And so as practitioners, we have to either accept that that's going to happen with our patients, or we can turn a blind eye to it. And the risk of turning a blind eye to it, obviously, is that then the patients are either going to switch to other physicians that are more accepting of it, or they're going to not tell you about it. And so what I wanted to find with this study is just to get a sense of what it is that we know. So there was a survey done by the NIH in 2007, and it showed that 38% of adults and 12% of children had used some form of complementary alternative medicine. This was a 36%, or this was an increase from 36% in 2002. And $33.9 billion of out-of-pocket spending on these practices and products. They looked at cross-sectional to see if there's any particular ethnicity, race, age, sex. People of all backgrounds use it. However, they did find that it's greater amongst women and those with higher levels of education and higher income. Now, part of that may be because it's out of pocket. Maybe that's, but that's what they found. And I think we can speculate what the different reasons could be for that. Now, the 10 most common CAM therapies that were studied in this survey, you can see the natural products by far exceed the other things. And that's, you'll see in our survey that is thankfully where we actually seem to have the most handle on our patients' use is of these products. So what this study found in 2007, and it's kind of sad that there hasn't been one more recently. I would have figured every 10 years at least somebody would do this, but the non-vitamin, non-mineral products are the most commonly used CAM therapy, and compared to 2002, it's increased. There's other therapies that have increased in use, such as the deep breathing exercises, meditation, which Scott just talked about, massage therapy, and yoga. And as most of you probably have noticed in your communities, there's like a yoga studio now, like in every other block. So, and the most popular products are probiotics, fish oil, or other omega-3s, glucosamine, echinacea, and flaxseed. And as far as services, most people are likely to seek care for musculoskeletal problems such as neck, back, or joint pain. And you can see the difference here. 17% is for back pain. Now, I wanted to present, and again, take it with a grain of salt. This is me as an integrative medicine practitioner. But I'm faced all the time with questions from patients calling and inquiring about the type of services and things that are part of complementary alternative medicine. And also on the counter side of it, when I meet with, or discuss with some physician colleagues about, how that compares to traditionally accepted medical practices. And there's a lot that we do, if we really take a step back and think about it. There's a lot of things that we do in traditional medicine that is taught in medical schools, that were taught in residency and practice, that there's not a lot of great data for that either. Yet we accept it and we proceed with it and incorporate it into our practices. If you look in Pharmacopoeia or Hippocrates or something, and just if you ever just pull up the mechanism of action of a lot of the drugs that we prescribe our patients, a lot of times it says mechanism of action unknown, and so and we don't generally question that as we are critical of what we consider to be alternative medicine type of practices and services. And I just gave some examples there. And there was a recent study that came out in the last couple of years about the need for lumbar disc surgery. That's a perfect example. Patients it was a large survey. MRI was done of the lumbar spine of people across all age groups, and they found that as much as 50% presence of disc disease in people over 50. And so one of the conclusions of the study was we're probably doing unnecessary disc surgery on patients, because these were patients without back pain. So just as an example that, even though there's a lot that we need to continue to hopefully research and understand about some of these alternative medicine modalities and products, we really should also be continuously critical of some of the things that we accept as traditional medicine. So the project that I did, we sent out a survey to family medicine, internal medicine, OB-GYN, ortho, neurology, PM&R, pain management, ER, and psych. And I just wanted to get a sense of their familiarity with some of these products and services and their comfort level. And you can see about 43% were family medicine, about 16% were orthopedic surgeons, 8.5% ER, almost 19% were internal medicine. So the categories that I chose to question the physicians about were vitamins, herbs, and supplements, the services of naturopath, chiropractor, osteopath, massage therapy, acupuncture, mindfulness, meditation, and health coaches. And so there were 7 questions that I asked in this survey. And I just wanted to, I may need to refer to some things that I jotted down here. So there were 176 people that responded to the survey. And as you can see, in question 1, it says, what % of your patients take or utilize the following CAM categories listed above? So that was the categories that are on this page here. And so broke it down into 0 to 10%, 11 to 25, 26 to 50, and over 50%. And basically, what I found was that the physicians that responded to the survey, we seem to have the most knowledge of our patients' use of chiropractic services and vitamins, supplements, and herbs. I would imagine part of the reason that we're so familiar with the vitamin, supplement, herbs is now we really are starting to incorporate that into the questionnaire, and intake when we intake patients. So in addition to getting a list of their prescribed medications, we're asking the question of what else they're taking, and we're acknowledging that there's potential interactions with prescribed medications. Second question, what % of your patients have asked your opinion about the above products or services? Now, what I was surprised based on the response here was that nearly all the patients for the physicians that responded to this had inquired about some form of complementary alternative medicine. Now, it's possible that it was mostly about vitamins and supplements, but that's, again, it starts the conversation or the thought process, and perhaps, if anyone else would ever want to do another survey, we could figure out some other additional questions to ask. A third question, have you ever referred a patient to any of the above services? And 82% of the physicians had referred or recommended a complementary alternative medicine, or CAM. And again, it's hard to break it down into that further what that would be. I was trying to limit the number of questions in the survey. But again, if I had to guess, I would say that it was most likely for vitamins and supplements. And then as a follow-up question, if you answered yes, then what was the reason? Was it whether patients didn't respond to conventional medical treatment? Was it based on patient request or other? Now, unfortunately, as you'll see, the numbers of responses exceeds 100%, and so that was a glitch in the question or the software. So the folks were allowed to select more than one, and so that'll need to be vetted out a little bit more in the future. However, as part of it, under other, patients or the physicians were allowed to enter comments, And I did get a fair number of comments, and I thought I just picked a few that I thought were really interesting or were most relevant to read off. And so the folks that selected the comments were, some of the physicians had personal interest in a more natural approach, so it was more their own inclination to recommend this to their patients. A lot of folks responded that it was patient request. There was one response that it can be helpful, especially for psychosomatic illness. Now that, could be and that's a whole different topic of a discussion, I think. But I think it does point to the notion that, if we can't figure out what the problem is, oftentimes in traditional medicine, our thoughts kind of start to migrate to, well, you know what, this is supratentorial, and this is probably the patient's, their psychosomatic stuff, and you know what, this would be a great patient to send to Dr. Mokari. Okay, and I do see a lot of patients like that. And then one person was offended that chiropractic was referred to as non-conventional. What can I say? And then another response was, some of it is good stuff. That was another quote unquote. Okay. And then the next question, again, this all refers to question 3. If they had answered no, what was the reasoning behind that? Just trying to get an understanding. And so, was it because there wasn't enough scientific evidence? Is it because you don't know any reputable practitioners in your community? Because you're not knowledgeable enough to refer your patients to anyone, or you don't have a system in place to refer or communicate with any of these such practitioners? Whether you're afraid of losing your patients to the dark side, okay? Or if there's, other reasons. And so about 50% of the practitioners who responded to this question said that it was because they felt like there wasn't enough scientific evidence. And about 42% felt that they didn't feel knowledgeable enough to refer. Actually, I want to correct myself. So 42% didn't know any reputable practitioners in their community. And that's something that perhaps, at least for me as an integrative medicine practitioner, is very useful to be able to reach out to colleagues and to let them know that there are practitioners that they, in the community, that they can refer patients to and feel comfortable. There we go. Now, the next couple questions I was very pleasantly surprised with. I didn't go into it with any real preset notions, but just probably leaning a little bit more on the negative of what I thought the responses would be. But I was pleasantly surprised that almost 73% agreed that the patients would benefit from consultation with physicians who've had further training or specialization in integrative medicine. And over 70% are willing to learn about integrative medicine through CME programs. So those are very promising. I think it tells me that we're recognizing that patients are utilizing these services, whether we're reluctant to use it ourselves or accept the benefits or risks that may be there for patients. Obviously, our comfort level can lie within all the different variables we talked about, whether there's enough research, whether there's enough practitioners in the community that we feel comfortable with, and so on. But we're willing to learn more about it for our patients' sake. So that was very encouraging for me. In conclusion, I think we can all agree that we're able to offer our patients a variety of different services within the realm of traditional medicine, regardless of what they're presenting with. And as a primary care physician, I was trained to be able to troubleshoot a certain amount of problems and then If they fall out of my realm of expertise or beyond a certain level of complexity, then we refer the patient to a specialist. And oftentimes then the patient goes to the specialist, and if they are able to get the solution, wonderful. If they're not, then there's really not a place for the patient to go from there. If they come back to us and they say, well, the specialist says, there's nothing they can do for me, or what I get a lot of times with my post-op patients is the surgeon says everything went great, right? So the surgeon now wants to wash their hands of this patient because the surgery went as planned. Now, whether the patient responded or not is not their problem, right? If you still have back pain after surgery. And so as primary care practitioners, when the patient comes back to us, and now we're trying to decide, do we send this patient to pain management? Do we need to deal with yet another patient who may fall victim to the opioid crisis, or just have to live with this chronic pain? Are there any alternative ways for this patient to find some benefit, some response? Whether it's a patient that you can see is also very anxious, and maybe they would benefit from mindfulness or meditation, or whether it's our increasing information that we have and data on acupuncture and its effectiveness for chronic pain. So it all has to do with our own comfort level and our exposure to these different modalities that are out there for our patients. And if we don't participate and make ourselves part of the conversation, then the patients are going to seek it with or without your consent. And then we're sort of left with, unfortunately, sort of this abyss of these different avenues for the patient to pursue that can be potentially harmful and oftentimes very expensive. So I encourage all of you to consider, at least be willing to have that conversation with your patients, and potentially just be aware of the practitioners in your community that perhaps you can feel more comfortable with referring your patients to. Thank you.